Interstitial cystitis is also called chronic bladder pain syndrome because essentially you're constantly having pain in the bladder. It's very common in people with endometriosis and in fibromyalgia, and it can just be something that cripples people in addition to having chronic pain in the pelvis or other places in the body. The bladder rests right along the pelvic floor muscles, which wrap from the pubic bone in the front to the tailbone in the back. And so when the bladder is inflamed or irritated, it can irritate the muscles underneath as well as some of the nerves and blood vessels that run close to it. Painful bladder syndrome can often be misinterpreted as a urinary tract infection. The biggest difference is on testing at the doctor's office. You'll get negative tests and negative cultures, which can be really frustrating for both the patient and the doctor as they're trying to figure out what's going on. And it's very disabling, interrupts sleep, and can be very misunderstood by other providers in the medical community who will again often think that it's a psychiatric issue or something else going on with the patient that has nothing to do with an actual physiological problem. The potential signs and symptoms of painful bladder can be frequent urination, only urinating small amounts, burning with urination, feeling like the bladder's full when it's not. A lot of people will notice tenderness on the bladder. There's a high correlation in patients who have painful bladder syndrome and pelvic floor dysfunction. And sometimes we're not sure which one came first because we're seeing patients so far down the road. But the general belief is that if you have painful bladder syndrome, it can cause pelvic floor dysfunction. And if you have pelvic floor dysfunction, it can cause painful bladder syndrome. So typically by the time we see patients, they're suffering from both at the same time. And so we work on treating both simultaneously. There are many treatments for painful bladder syndrome, and some of those may be medications or injections that can help release the pressure on the pelvic floor, which then relieves the pressure on the bladder that may be contributing to the frequency of urination and to the pain symptoms involved.